The problem becomes obviously times like COVID. Now, I know, Demetrius, you've been struggling to get, even if people have tears or partial tears, with COVID, everything has stopped. Like, how have you guys sort of seen bicep injuries and how you manage bicep injuries?
So nowadays the main problem lies our NHS practice, where the patients come sometimes take a few weeks to be referred from their GP, or it takes a while from them to be seen in our fracture clinics. So I'll be honest with you, over the last 6 months, we have been doing basically delayed repairs of biceps tendons rather than acute repairs of biceps tendons. Of course, you need to select your patients as soon as you see a patient. So the patient can be either in the younger population cohort where they had an acute injury, they are a builder, a manual worker, or an athlete. These patients tend to seek advice quite sooner. And there are the other patients where they're around their 50s or 60s who have sustained an injury, and they go through the conventional way of going through their GP, get referred, etc. You need to approach individually these patients and ascertain that they actually need to have something done about it. When we're talking about a complete tear of the tendon, you need to explain to the patients that they will lose some force in their arm. So if you are a builder, for example, and you lose supination power, you'll have problems screwing or doing hard manual work for the rest of your life. So it's maybe you have to repair it basically. If you are in the more elderly population cohort, you need to see the hobbies, the demands of the patient life, if they want to ride motorbikes or bicycles, and you have to commonly agree to proceed with surgery or not. If they think that they can manage throughout their life with just non-operative management, then of course I'm sending you to Euros, and then you manage their expectations. You try to make their elbows as fit and strong as possible, and they get on with their lives absolutely fine.